Welcome, everyone, and Happy New Year to everyone. And I cannot believe it. I just saw the 2024. We start this seminar series is January of year 2000. So this is 24th year of these seminar series. So we have been really successful to have a great speaker to come to talk to us, and also on the whole campus to spread the word of how important the nutrition is. So it is my pleasure today to have Dr. Michael Thomsen to present the seminar for us today. He's the director of Center for Study of Obesity in College of Public Health, and where he holds the Governor Sidney McMath Chair in Obesity Prevention for past 2-3 years. And he joined the UMS after 23 years on the faculty within the University of Arkansas at Fayetteville and University of Arkansas Division of Agriculture. Over his career, Dr. Thomsen research has focused on the interaction between the food distribution system and the human health, with the specific focus on the childhood obesity in Arkansas. He has worked in the partnership with the Arkansas Center for the Health Improvement, or ACI, to identify environment contributed to excess weight gain, and to understand the needs for a student population at the greatest risk for developing obesity. Also, he led the multidisciplinary initiative to promote local food systems that are capable of providing fresh fruit and vegetable to Arkansas community.
Oh.
Finally, his research program is helping
he's right there.
Am I okay? Okay. His research program is helping on clarify the role of the nutrition assistant on diet health and food security. He is also current research supported by 2R01, which is very rare on this campus, somebody to have 2R01, which is multi-million-dollar grant, and also another one from Robert Wood Johnson Foundation, which is, again, that huge multi-million-dollar grant. I got to know Mike when he joined the UMS. I was so excited to have him on this campus because both of us, we are almost alumni and working at the U of A Fayetteville for a long time. Also, he has published more than 70 articles in the top journals, and also more than 80 national and international presentation. And the other thing that everyone should know, he is a great mentor and teacher. He has taught a lot of courses in both campuses, and his mentees are really fabulous to work with. So I'm going to take and save his time and welcome Dr. Thomsen.
Well, thank you very much for that kind introduction, and it's a pleasure to be here this afternoon. And there we go. Okay. You'd think I know how to do this by now, right? We've got a lot to cover today. So I know you all have objectives for these CME credits. And so our objectives today are just to have an awareness of the current policy landscape around universal free meals. And I just learned before the seminar that many of you are doing rotations in child nutrition programs across the state. So correct me politely if I'm wrong, because you may know more about some of this than I do. I'm an agricultural economist by training. Over my career, I've hung around with a lot of people doing work in nutrition and know that that's some of the best people on earth. But I can't claim to be a nutritionist. We also want to talk today, just so we know, what do schools have to do to be on universal free meals, especially through the community eligibility provision. And then I'm going to explain some of the work that we're just launching that's using some really big data sets. These are big administrative data sets and also proprietary commercial data sets to understand the effect of universal free meals on the food economy. So, you may know that some of the food industry companies are really using these big data sets. They're expensive and they use them, to market food to us, right? Well, we're using some of those same data sets, but to try to understand, how school nutrition and, other nutrition assistance programs can affect our economy and also behaviors. And then a key takeaway today is that we think about school nutrition and we think about school children. I hope by the time we're done, you can see that school nutrition might affect senior citizens. Okay, it's going to have broader implications than just schools. Okay, I do have a disclaimer. Some of the work I'll be touching on today receives support from the National Institutes of Health, from the National Science Foundation, from the USDA, from the Robert Wood Johnson Foundation, and the content is solely my responsibility and does not necessarily represent official views of any of the funding agencies. All right, so with child nutrition programs in the USA, there's really two big ones: the National School Lunch Program. This was started with the National School Lunch Act in 1946. And let's think about what was happening in 1946. Harry Truman was our president. The World War II ended, in August of 45. A lot of the national impetus for the National School Lunch Program was concerns about lack of adequate nutrition and military readiness. And if we think about today, one of the leading reasons why young people can't serve in the US military today is related to diet-related, obesity and other conditions. And so we've kind of gone full circle. School meals can play a big role, not just in nutrition, but in, broader national security implications. The school breakfast program was started as a pilot project in the 1960s, 1966, and then became permanent in 1975. And I will touch on a couple of other nutrition programs today, just in passing. The summer food service program, which became really front and central during the pandemic, and also the fresh fruit and vegetable program, a fresh fruit and vegetable snack program. Okay, so let's be clear what we're talking about when we say universal free meals. When I say universal free meals, I mean that all enrolled children are provided free meals without an individual level income eligibility test. Okay, so if we go back to 1946, when we look at the School Lunch Act, it requires schools to provide free or reduced price meals to eligible children. So any school that participates in the NSLP has to provide free meals, but it's only to eligible children, right? And so all schools have always been providing free meals, but they haven't been providing free meals universally. So if a school is providing universal free meals, everyone who goes through the line receives a free meal. So maybe in the picture here, the young lady in blue, maybe both of her parents are pulling down, great big salaries. Okay, she didn't have to check in and she wouldn't qualify for free meals, but she's getting a free meal because the school's providing universal free meals. And maybe the young man beside her, is from a less affluent family and would qualify for free meals, but he's also getting a free meal. And so in some sense it equalizes, and we're seeing more and more stigma with school meals. And so universal free meals can be an issue that helps to address some of that stigma. Now, universal free meals are not really brand new. We've had them since the 1980s. And Arkansas schools have been providing universal free meals through Provision 2, which means the school just needs to take meal applications once every 4 years. They kind of get that base established, but they do have to provide free meals to everyone. Okay. And provision 3, a little different reimbursement mechanism, but again, about a 4-year interval, some flexibility, some is in there, but typically every 4 years you're taking meal applications. And then, the school does need to provide universal free meals from that point on. Where universal free meals have really taken off is with the Healthy Hunger-Free Kids Act of 2010. And incidentally, our Senator Blanche Lincoln of Arkansas was very instrumental in getting this legislation passed. So there's a lot of Arkansas roots in the Healthy Hunger-Free Kids Act. And this introduced the community eligibility provision. And so let's do a little jargon alert just to kind of make sure we're on the same page. The community eligibility provision allows schools to provide meals to everyone, but not all schools are eligible to participate. So to participate, the school has to have an ISP, which stands for Identified Student Percentage. And basically, this is the share of the students that attend the school who are certified for free meals through the Supplemental Nutrition Assistance Program, the Temporary Aid for Needy Families program, Medicaid, or children who are otherwise categorically eligible, for example, foster children. Okay, so the number of children that are directly certified for free meals is that school's ISP. Okay. Now, the question that I pose here is, what do schools are actually eligible? Well, the answer is very simple. The school can be on the CEP if the ISP exceeds 25%. Now that's just new, October 2023. Okay, historically, since the CEP has been in existence, it's been 40%. Okay, so I don't know if there's a lot of schools that have got on the CEP at a lower than 40% this year because it was October before this went into effect with the federal fiscal year. But schools within a district can also combine. So maybe, there's several elementary schools, some don't meet the ISP requirement, but some exceed it. Together as a group, they may meet it. And then, so everybody in the district can participate in the CEP. Or maybe a middle school doesn't meet it, but the elementary schools do. And so you can combine and get free school meals to the middle school students as well. Okay, so then what happens if a school goes on the CEP? Well, should be catching on by now that everybody gets a free meal, okay? And the school must provide those free meals. And it's not just lunch. If they participate in the school breakfast program, they've got to provide the breakfast as well. And the way the school gets reimbursed is dependent on that ISP. So suppose the ISP is 40%, then there's a multiplier, which is 1.6. I hate to take you through all the arithmetic, but 1.6 times 40, what's that? 64% of the meals are reimbursed at the full free rate. And then the remainder, 36% of the meals are going to be reimbursed at the paid rate. And you can see in the little yellow box what those rates are in Arkansas right now. And so there's a bit of an economic calculation for the schools. If the school goes on the CEP, they do get more of their meals reimbursed at the higher free rate, but they've got to provide the meals free to all children. And so they don't get to collect the $3.25 from the students that would otherwise be paying for their lunch, right? And so they only get the 40 to 42 cents. Okay? So there's a cost to going on the CEP, although there is also a benefit. And so just to kind of see how that might work economically, I've just got a little demonstration here. And we've got revenue on the vertical axis, then we've got the identified student percentage on the horizontal axis. And the dashed black line would be kind of the revenue profile across ISPs if you were not on the CEP. Okay, now let's think about economics 101. What happens if somebody gives something away for free? Do more people take it? Yes. Okay. I'm not sure everybody could hear the answers from the audience, but yeah, that's a resounding yes. That's the law of demand, right? You lower the price of something, we're going to see more uptake. And in fact, the uptake is probably going to be mostly from those children who were otherwise paying for their lunches. And so So the red line would be the case where you really increase the paid, otherwise students that would have been paying, you increase their meal participation. You can break even. That red line crosses the dashed line at a lower ISP than say the blue line, where the paid increase is only about 10% in this example. And this is just an artificial example, to kind of demonstrate some of the economics here. But what, typically I see a lot in the literature about a 30% increase amongst the paid students once the school goes on the CEP. So that purple line might be, maybe more typical. And we do see that those schools that are kind of closer to that 40% level are less likely to be on the CEP. And then by the time you get 62.5%, 62.5 times 1.6, I think equals 100. Okay, all the meals are reimbursed at that or beyond. All the meals are reimbursed at the higher free meal rate. And so then that's why you see a kink in those red, blue, and purple curves. Okay. And then as nearly everybody's would otherwise qualify for free meals, then the CEP, the real benefit of the CEP is you're gaining those meals from the students that might not otherwise have participated, right? And so you have less to gain there. And so it starts to kind of become less of a revenue play. But there's some benefits to the CEP that may not show up in this little example. One is you've got lower burden. Nobody's taken school lunch numbers. Nobody's following up with parents. Hey, little Johnny's school meal account is getting low. You need to send some money. Nobody's trying to deal with unpaid meal debt. Okay, so those administrative burdens are reduced. From the child's standpoint, you're reducing the stigma of participation. Some families would qualify for free meals, but they don't because they don't want to take a handout, or for some reason they feel stigmatized by participating in a free school nutrition program. Some children may not want to participate because I don't want people to think that I'm from a poor family, even if I'm not. There's a lot of stigma around meals. I think that's probably increased over time. And another advantage here is that it provides a real motivation for schools to grow those meal programs. Because what happens, you'd rather be on that red curve than the blue curve, right? And so that's a real motivator. Okay. And so one way that a lot of schools across Arkansas and across the US are using to try to grow their meal programs, especially breakfast programs, because if you look nationally, breakfast, the number of breakfasts served across the country is about half of the number of lunches. I think about 2/3 the number of Arkansas children are participating in the school breakfast program as participating in the school lunch program. And what's the problem with breakfast? Well, traditionally you have to show up early to school to get your breakfast, right? And so if you're tired in the morning, or mom or dad or your parents tired, you may not be there. And so a number of years ago, we started working as part of Healthy Active Arkansas. I ran into some really wonderful people at the Arkansas Hunger Relief Alliance who are really working to push breakfast after the bell. And we had a USDA project. We were looking at school policies and food environment and so forth. And we were able to look at breakfast after the bell with some administrative data from ADE. And we really didn't see a lot of benefit in terms of academics. Now I've got some really exciting breakfast after the bell results I'll show you later, but we first were set out, we're going to see what this does, to academics. And I think the takeaway is that you can work breakfast after the bell into the rhythm of the school day without academic suffering. Okay, because there was some concern that, hey, if we take 15 minutes for breakfast in the classroom, that's 15 minutes, we're not doing math. And we really do worry about those test scores if we're a school administrator, right? And so I think we've got pretty convincing evidence that, yeah, you can put breakfast after the bell in without impacting the school day. We didn't really see an effect on BMI. There's some evidence that children, when they have breakfast after the bell, get 2 breakfasts, okay, one at home, one at school. We really saw no effects there. We didn't publish those. But we did see some really interesting stuff on discipline that I'll show you in a moment. But breakfast after the bell in Arkansas will typically be breakfast in the classroom for the younger children. There could be some grab and go breakfasts as children get older. Even in elementary school, we have some schools doing that. For the older children in secondary schools, often it's a second chance breakfast, or that's a common delivery mechanism. So maybe between first and second period, there's a chance to, pick up a bagged breakfast between classes. So it can take different forms. And if we look at the right panel, this is breakfast after the bell is there in red. And you can see that since 2012, 2013, when Arkansas schools really started this, we've seen a big growth, and about just under half by 2018, by 2019, 2020, the last year, we had before the pandemic, were engaged in breakfast after the bell. And so for context, you can't see from this chart, there's about 900 and something schools across the state, okay, public schools. Okay, so the left panel shows pre-pandemic adoption of universal free meals under the CEP. So the Healthy Hunger Free Kids Act was passed in 2010. In 2011-12, we have 3 states piloting the CEP: Illinois, Kentucky, and Michigan. And then that expands to include New York, Ohio, West Virginia, and the District of Columbia in 2012, 2013. And then we add Georgia, Florida, Maryland, and Massachusetts in 13 and 14. And then Arkansas and the rest of the country are able to go on the CEP if they want to in 2014, 15. Okay, and that's when we first in the ADE data start seeing CEP schools. So if you look at the right, you'll see, well, wait a minute, how come there's universal free meal in 2012, 2013, before Arkansas was able to go on the CEP? Well, those were Provision 2 schools, right? We still had these other mechanisms, and we still have schools on Provision 2. Provision 2 didn't go away. Okay, but the point is, as we think about how to analyze this problem, because it's very hard to do some kind of RCT. We've got administrative data. These are federal programs. You can't withhold it from someone ethically, or nor would you, right? Nor could you. We've got to take the data the world gives us, and we have to use strong causal inference strategies to try to get the best results out of these administrative data. And you can see there's a bit of a natural experiment lining up here. We've got some states coming in at one point, some states coming in at other points. Okay, we're going to try to exploit that, as we move forward with our research program. Okay, so here's the trends in school nutrition programs over the past few federal fiscal years, okay? And I don't want to spend a lot of time on this slide, except for the numbers on the left are the number of meals served, and those look like pretty big numbers, don't they? And the axis on the right is the percentage of meals served free. Now, what's kind of striking about during the pandemic, if you look at that red line? Were people paying for their meals? No, we had pandemic waivers that provided free meals to all children. Essentially, what have we done? We've piloted a universal free meal program as a result of the pandemic, a nationwide universal free meal program. Okay, you can see that before the pandemic, that about 68% of the children were on receiving meals for free, okay, either through the CEP or through, a meal application. And then that was about the same after the pandemic. So we went back beginning in August 22, we had to start taking meal applications again, right? Or if the school wasn't on the CEP or on Provision 2 or something like that. Okay, so just to kind of see what was happening during the pandemic. Well, coming out of the pandemic, we've mentioned those waivers. All the children got free meals. We could see that in the previous slide. But there was other flexibilities that were provided. So some rules were relaxed related to congregant settings, that people could pick up meals and go home, right? There was flexibility on meal hours to facilitate social distancing. There was some flexibility on nutrition standards. We're going to see momentarily that the Healthy Hunger Free Kids Act really also did a lot to improve the quality, the nutritional quality of school meals. Those had to be relaxed a little bit during the pandemic just to get food to the children. And sometimes it was a week's worth of food they were taking home. And, we needed to have more shelf stable things and such. And then there was additional flexibility in some of the summer food programs. Well, most of these waivers have ended at the end of the summer of 2022. But now look at the map on right. And what you can see is a lot of states are saying, hey, we just had these universal free meals. And so any of the states that are in some shade of blue, if you're, a child in Minnesota, for example, you're getting a free meal at school, and you're not filling out a meal application. Or any of the colors that are, brown or yellow, okay, they're not permanent, but they're decided at a state level to continue those waivers. And now the green states they're considering, as of August 2023, when this map was put together, they're considering some form of legislation to enable universal free meals at the state level. So even though the federal waiver is over, there's quite a big interest in universal free meals. Now, the states that are gray, unfortunately, Arkansas is one of them, are not considering those. And I don't know if it's, it's not making a policy statement here, but Arkansas should be colored something different than gray. Anybody know what happened in Arkansas? Last March, what did the legislature do? If you're on reduced price meals, you're getting free meals. That's like 15% of our kids. Okay. And so we should be, I don't know, they should have some color for Arkansas, because Arkansas is, not just sitting on the sidelines when it comes to this. Okay, so many of you know about the pandemic electronic benefits transfer. It was designed to provide additional support for families who were losing meals when the schools closed. Well, beginning January 2024, there is a summer EBT to replace meals when children are out of school in the summer. And not all states are participating, but Arkansas is one of them. And so that's another, kind of thing we've learned from the pandemic, and that's continuing. Okay. All right, so let's go to nutritional quality. And I want to move through this relatively quickly because I'm not a nutritionist and you are. But you can see on the chart at left, this is the healthy eating index computed over school lunches. Okay, it's not what people who are eating school lunches, what their healthy eating index was. It would be just, if we took the school lunches, we computed a healthy eating index over the school lunches, this is what it would be. And so in the 2010, okay, the healthy eating index is what, around 58 to 57. And you probably know NHANES as good as I do. What's typical for an American consumer? Just above 50. Okay. And of course, so the healthy eating index of 100, okay, you're just following the dietary guidelines perfectly. Okay. And the lower it is, the more departure you have from the dietary guidelines. Okay, with the school meals in 2014, 2015, okay, the Healthy Hunger Free Kids Act nutrition standards have now gone into effect. They started going into effect in 12 and 13. We see healthy eating index across all levels up into the low 80s. That's a significant improvement. And so, school meals are of higher dietary quality than they were 10 years ago. And you can see this is meaningfully higher. Okay? And so and even, if I go to conferences, and and people say, oh, well, my children don't eat meals because, they're so terrible. But even if it's a hot dog or a corn dog or something, it's going to have lower sodium and it's going to have whole grains and it's going to be reformulated. I don't know that those are but so the school meals meet these standards. And so that's an important thing to keep in mind. All right. So how important is school food to developing preferences? And I'll go through this pretty quick. But a number of years ago, we were looking at the fresh fruit and vegetable program. And if you're not familiar with that, that provides children with a free fresh fruit or vegetable snack at least twice a week within the school day, but outside of normal meal times. And often it's in a classroom. Okay, it doesn't have to be, but often it is. And it was exciting when we were doing this because we really weren't into the CEP was just starting, and here was something. The fresh fruit and vegetable program is given to every child, whether they participate in the NSLP or not. Now it's offer as opposed to they don't force it on you, but I actually saw it in practice because they have this thing called a watchdog dad, where the dads can go to school, and I had a little daughter in elementary school right by the university in Fayetteville, and they were a FFVP school. And, the cafeteria staff brought in this nice bowl of, I guess it was probably nectarines. And the children could take one if they wanted to in a napkin and, and eat it. And they didn't have to take it if they didn't. And I thought that was kind of interesting. And one day I was chopping up salad or something, preparing dinner. And I put tomatoes on my salad and on my wife's salad. And my daughter looked at me and said, "Dad, how come there's not tomatoes on mine?" I said, "Well, you don't like tomatoes. I like those kind." And they were those little cherry tomatoes, grape tomatoes. And I said, "Okay." So, and I figured out why did she like them? Because she got them at school. Okay. And so as parents, we give up on our kids, we give up after like 3 times. Okay. My daughter doesn't like tomatoes. Kids really have to see things a lot more than 3 times to actually develop preferences for it. And so we actually, because we had access to the Arkansas BMI data, we were actually able to show some benefit in terms of body composition for children who were on the fresh fruit and vegetable program. It wasn't a big thing, but it was, to some extent, it was meaningful, and there was, caught the attention of some of the press out there. Okay, so when I talk to, people working in child nutrition, they say, well, I really don't think a fruit or vegetable snack twice a week or 3 times a week could have any effect on body composition. I think you got an association there. And so I really wanted to think, well, I don't think it's the snack they get at school. I think it reinforces, it reevaluates, it allows healthy preference formation. And so what we did is we, developed a little model to try to model this and get some intuition about it. And I may skip over it just so I have enough time, but essentially we were able to show that if we had, I'll just skip to the takeaway here. We were able to show that that even if you lived in a poor home food environment or a poor food environment, we actually, it's not human data, it's modeling data, because you really can't model a fresh food or vegetable intervention over multiple years at scale. So it's, but we tried to get some intuition out of this. And if you read these numbers, the 7-digit numbers you see would be the, for example, the triangle in the legend, that would be a child who was in FFAP in year kindergarten, 1st grade, 2nd grade, 3rd grade, 4th grade, 5th grade, 6th grade. It's primarily an elementary school intervention, so we didn't really go beyond 6th grade. That little star would be someone who got it in kindergarten only. The square would be someone who didn't get it in kindergarten 1st or 2nd, but got it in 3rd and 4th, but not in 5th or 6th. Okay, so that's how you kind of interpret those numbers. And so it's a model, so it's kind of simplistic, but we got the worst to the best food environments. And we got preference learning. That's really what we modeled. And I won't take you through the details of it, although we might at some time in the future. And you can see if you're in a good food environment, you're going to kind of develop healthy or learn healthy preferences just because you're exposed to it all the time. But if you're in a poor food environment, anybody who is in that 7 consecutive ones pretty well learns healthy preferences, right? All right. Well, let's look at those that never got this intervention. So the X's. A lot of the X's are down there towards the bottom at the left. Okay, they didn't get a chance to learn those healthy preferences. But if we could give them FFVP just in kindergarten, we would get a lot better results. Okay, and that FFVP in kindergarten would be just as good, if not better, than FFVP in 2 years in the 3rd and 4th grade. Why? Because once those preferences start, they kind of start to build on each other, right? And if we could only give FFVP in the 6th grade, it's almost not effective, right? So that's kind of a long answer to that. If I would have had that, I could have explained that at the cocktail party or wherever I was at, right? Okay, so let me get to one of the main points for today, and that is, can universal free meals affect food at home? And let's just think about this for a minute. If you've got gray hair like I do, you might remember McDonald's used to have signs that said 4 billion served, okay? 5 billion served. Then it was billions and billions served. They just didn't keep track anymore. Any idea how many school lunches are served in a given year? 4.5 to 5 billion. 2.5 billion breakfasts are served. School meals are a big part of our food landscape. Okay, I mean, this is economically meaningful, and actually, some economists are starting to look at this. And so, there's a recent article in the Journal of Health Economics. When schools go to universal free meals, the families that are most effective spend about $39 less at the grocery store. Well, that's kind of bad if you're a grocery store, isn't it? Is it going to be easy to raise your prices if people are spending less? No, you're going to have to keep your prices more stable. And I've even had concerns expressed that, oh goodness, we're going to be losing grocery stores because people are buying less at grocery stores once we go to universal free meals. And that's not an invalid concern, although I don't have any evidence on that. But there's evidence that universal free meals affect food at home purchases, and that they're actually affecting grocery prices. And I was talking to the Association of Arkansas Superintendents, I forget the exact name of it, and we were talking about universal free meals, and I cited those studies, and I showed them the chart there that you see about food price inflation right after the pandemic. And there's just a great deal of interest. Why? Because maybe primary voters are not clamoring for child food insecurity measures, but everybody cares about food price inflation, right? This resonates with a whole new audience. So if we think about that previous slide, look at that NBR working paper. School food policy affects everyone. Okay, we all have some stake in this, whether we have school children or whether we are a school child, or if we're, because we all buy stuff at the grocery store, right? Okay. So there's this preliminary data out there, and USDA has some really neat data sets that they're using to do things like their oh goodness, why am I blanking? I have it right here. The Thrifty Food Plan. So, what determines SNAP benefits is defined by what people are actually buying, and you need good data to kind of come up with that, right? Okay, so we proposed to the Robert Wood Johnson Foundation. I think it's USDA money that's going through the Robert Wood Johnson Foundation. This actually runs through Arkansas Children's, because the data sets are the legal agreements we have to approve for these data sets. UMS can't sign them as a state entity. It just violates the Arkansas Constitution. There's just nothing you can do without changing the Arkansas Constitution. But Children's, we could run the grant through there. So this grant goes through Children's. But we're kind of, the model here is universal free meals. What's that going to do? It's going to affect change in demand for food at home. People are just buying less because more of meals count for like 60% of the child's daily caloric intake. Okay, this is a big part of families' food budgets, but they may also be affecting preference learning, which could also affect demand. See, you kind of see that angle there. That's why I kind of drew you through that model. And then that's going to have an impact on retail food prices. And what we're really doing beyond what's already been done is, what is the effect on the cost of a nutritionally secure diet? Okay, I mean, we may see that food prices fall generally, but actually the healthier items are actually not affected or increasing, or we might see that, the healthier items are actually lower. Okay, and then what does that do to the nutritional quality of food at home purchases? Not just the cost, but also what people are actually buying. So the way we're going to do this is we're going to take data, the little green circles are data that's in the public domain. If you have an internet connection, you can get it. So in 13-14 and then 15-16, the National Center for Educational Statistics, they mapped all the school catchment areas across the country. And this is really pretty neat. So you can see where would children who live in this particular census block go to school. Okay, if they're in elementary school or middle school or so forth. Okay, so we know what areas, what households would have been exposed to universal free meals, right? And then we also know what schools were providing free meals. That's in the National Center for Educational Statistics. It's also in some repositories because NCES only started reporting this in like 14-15. Okay, but fortunately, Food Resource Action Center had compiled some data, and so we can kind of piece together a history of CEP. And then we're using the Food Acquisition and Purchase Survey to kind of see what stores are likely to be affected. Because, you know, if you think about a store, how far do you travel to get to that store? So we can't just say, oh, this store is in a school that provides CEP, because, you know, people from way out of there might be coming to that store, right? And so the Food Acquisition and Purchase Survey was a really big, it's not a really big survey, a really expensive survey. It's actually kind of small, but it got a lot of information on how people procure foods. And we're using a restricted use version of it that we're having through the project. And then we're using kind of the gold standard retail store location data through Nielsen, you know, the people who do your TV ads or whatever. They also put together a lot of information for the food industry. And so we're using the TD Links data, and I don't know what that stands for, but it's got stores, we know how many cash registers are there and so forth. We know where they are, okay? And so we can figure out how affected would an area have been by CEP. So then we kind of turn that into a store and chain level exposure. And it's really important to look at chains because chains tend to price the same. So maybe, you know, a store in one area of town's really impacted by the CEP, that if that you have a chain over in a more affluent area, if they lower prices here, they're probably lowering prices there, okay? And so it could go well beyond any even neighborhoods that are affected by the CEP. Then we're using InfoScan data. So when you go across the supermarket and you buy something, you hear a beep and that's going up into a database somewhere, right? Okay, well, you know, food companies buy that to see, well, how well are, you know, Tyson Foods might be wondering how well are any Tizers doing in the Sacramento market, okay? And so we know what's going through stores. And then we can use that to get an idea of what is the cost of the Thrifty Food Plan, because we can, and then to try to get an idea of the diet quality. You may know that USDA has linked up all the NHANES foods with prices, okay? And that's going to help us kind of with the Thrifty Food Plan, but they've also linked up all these a purchase to plate crosswalk that links up these scanner data through the nutrient databases, so that now a box of Lucky Charms that goes across the scanner is no longer just a box of Lucky Charms. It's so many dietary fiber, it's so many added sugars, everything else. Okay, so we can use the healthy eating index methodology to compute a healthy purchasing index. Now, I've been told I should call it a healthy eating index, although I don't know. They're not eating it. This is a purchase, right? And so it is the healthy eating index methodology, but we basically are computing a healthy purchasing index. Okay, so let's think just about our breakfast after the bell and the other kind of big universal free meal study that we're starting. So we were able to show that when children get breakfast after the bell, they got in trouble less. And that kind of caught the attention of some of the local news channels. And it was a really robust finding. It was published in, you know, the agricultural economics profession's very best journal. Okay, it was robust. And what we really saw was that the strongest evidence was at the intensive margin. And by that, I mean the children who are already getting in trouble, they got in trouble less. Okay. It wasn't so much that, you're going to get in trouble at school, but so it didn't really affect, the probability of getting in trouble at all. But if you were getting in trouble, you got in trouble less at school. And the larger benefit were to the lower income children who we'd expect to be facing more food insecurity. The larger benefits were for minoritized populations who are more likely to be in trouble at school and receive stronger sanctions if they are in trouble. And then it was a larger benefit for boys who are also more likely to be in trouble at school. Okay. And so it's a fairly strong study, although, obviously not an RCT, but we could track the same children over time from kindergarten through 7th grade. And the kids get in trouble the most right about 7th to 9th grade. Okay. They actually start to get in trouble less. Either they behave better or they're smarter and don't get caught, as they get a little bit older. But, we're kind of looking at that run up when they're really most likely to be in trouble. And we're looking at the children who got exposed to breakfast after the bell by 3rd grade, and we can really see those differences. And so that led to the preliminary data we needed for NIMH R01. And so if children are getting in trouble less because they have better access to school meals, could that affect the biggest mental health condition facing children, which is ADHD? And we know that ADHD can sometimes be misdiagnosed. Did you know that if you're an elementary school child and your birthday is July 31st, you're 20% more likely to have ADHD than if your birthday is August 1st? Any reasons? Yeah. Yeah. So the comment is, there's a relative age effect. If your birthday is July 31st, you're a 5-year-old in kindergarten. If your birthday's August 1st, you start kindergarten as a 6-year-old. There's a 1-year developmental gap. And what's really being diagnosed as ADHD turns out to be relative immaturity, right? Okay, well, what if somebody's facing hunger pangs because they're, food insecure? Could their behavior be, maybe they need a nice breakfast or lunch, could their behavior be misdiagnosed as ADHD? That's kind of what we're trying to look at here. And so here's a little quote from a nurse in Jonesboro, and this was a breakfast after the bell quote, but it could apply to universal free meals as well. If kids have something in their tummies, they're going to have a better day. Okay? And we kind of call it the hangry hypothesis, right? I mean, that's actually, hangry became an official word in the Oxford English Dictionary, I think in 2018. So there's a lot of hangry to go around, but it'd be good if we didn't have it, right? Okay, so our central hypothesis, and we really spent quite a bit of time in the literature, and we do have some, good people. I'm an agricultural economist, but I do have on the study team, people with expertise in these behavioral disorders. But the idea is that there could be multiple pathways by which school meals could affect diagnosis of these behavioral disorders that could have an impact on academic outcomes, discipline, as we've shown in the preliminary data, and then mental health service utilization. Well, you were uniquely positioned in Arkansas. So NIMH had a call that wanted to link together secondary data sets to really look at questions that hadn't been able to be looked at before. And we've got the Arkansas All-Payer Claims Database. We've got these data from the Department of Ed. We have the BMI panel. And so what we propose is to link these data sets, and we're doing it through an honest broker arrangement. Arkansas Center for Health Improvement is the honest broker. And I'll tell you, I've got FERPA on one side and HIPAA on the other side. And, it takes a lot of lawyers and persistence, but we've got the data set linked with a hash that can, have it blinded through the honest broker arrangement. And we're still, of course, very careful, but we're able to look at this question, linking school meal policy all the way through to behavioral disorders. Okay. Well, I want to leave some time for questions. So I will just close real quickly by saying we're doing quite a bit of community-based work in the Little Rock area. So this is a catchment map for schools in Little Rock. If you move to our city, and you could use this map to know where your child would go to elementary school. I'm just going to show you another map here. Any guess what's being shown here? You can see different colors. What do you think this map is showing? Yellow means something, blue means something. I've got the catchment areas for 5 of our elementary schools in kind of fluorescent green, and the schools are located, where they're at is in fluorescent green as well. But what do you think the data are behind it? Actually, that's not so the answer in the class was, or the seminar was, economics. That's not a bad answer. Okay, it would look very similar. It's not economics, but it would look very similar. It's actually CDC projections of adult rates of diabetes. Okay, so we're doing quite a lot of work with Little Rock Community Schools. It's a partnership between the city and the school district, but from a College of Public Health standpoint, there may be an opportunity to really try to address health equity in our city, through schools. So we're working on we've had some conferences on ways to address health equity through community schools. We're working on a green schoolyard initiative, which is actually funded by NIMHD. I won't take you through all the details, but we're also working on some nutrition education with some of the schools. So we have a partnership with Culinary Medicine. Chico Elementary is one of our community schools. Here you see the Chico Elementary catchment area in red. It's overlaid on OpenStreetMaps, and these are all the SNAP stores around Chico as of November of 2023. And then we're going through, in fact, Dr. Lopez Nyman, who works in our center, did most of it. I've been through a few of the stores. We go through, and we do a quick store audit of each of those stores. And, we kind of know that Kroger's going to push all these buttons. We don't know about some of the ethnic stores, and some of them really are great stores. Some are not so great, but we've identified the stores, and then we're seeing, we're planning it'll be family-based cooking classes. 3 of them are scheduled for March, and we're planning based on what's available in the neighborhood, what the costs are going to be. We're actually interviewing, when the people sign up, we're seeing what the kitchen implements they have. We really want this to pilot this so that, we can do more nutrition work with our schools. And Chico is just one of our most exciting schools. They have an amazing food pantry, really designed with health in mind. But we're trying to build out, this community focus, as well as just kind of sitting in an office with some really big data sets. Okay, so just to close, I want to thank quite a few people, and I won't thank them individually, but just know that there's a lot of teamwork involved in this program, and I am grateful to have 3 really great postdoctoral fellows in the center, and really great collaborators both here at UAMS, across the state, and also elsewhere across the United States. So thank you for your time. Yep.
Thank you very much. Any question for
Can you hear me? Yes.
Yes.
Okay. Oh, that's awesome. Okay. So I am a female and have ADHD and was just recently diagnosed, and I'm 22. And so I think I'm just curious about talking about ADHD of children acting out, because that's normally what people think of as rambunctious little boys, but that's not necessarily true for ADHD, because most women aren't diagnosed until their 20s or 30s, because it's very internalized, and basically it's just emotional dysregulation, layered thoughts, and it can be misdiagnosed as anxiety. So do you think that, since now there's a lot of research coming out about how ADHD represents in young women, do you think necessarily maybe it's fair to say that ADHD children are less likely to act out because most ADHD children don't act out. It's just the ones who do, who are rambunctious little boys, get that attention, if that makes sense.
Yeah, and I think that's a very, very good point. I didn't mean to kind of mischaracterize a whole condition, and that reflects to some extent, my background. And I do have people who are very cognizant of these conditions on the project who are advising us. But kind of the answer to that is, we do see more in boys, probably for that reason. There's a higher rates of diagnoses among boys for sure. But what we're going to be doing is we'll be able to identify those that have been clinically diagnosed. And I don't want to minimize this disease by any sense. I mean, it's a real disease, and it's it's just there's not a blood test for it, right?
Yeah.
And so with our ability to link the data sets, we'll be able to see those that were diagnosed before they ever got universal free meals. And we're going to be able to see, do they have less healthcare utilization? Are they doing better in terms of academics, in terms of any number of issues? Because, the way that, if you really get into the literature, I mean, nutrition can affect the behavioral disorders we're actually looking at are ADHD, then oppositional defiant disorder, and also conduct disorder. But nutrition plays a role multiple ways through there. Not just, I'm hungry and I'm hangry, but I didn't mean to kind of minimize that. And so I appreciate the question and the comment. But yeah, you make a very good point, and I appreciate you making that. Yes. Yeah, well, no, I mean, we do, cover a lot of our literature review is going to cover a lot of different countries. I haven't really personally analyzed any data from other countries. In fact, a lot of my program has been Arkansas data, right? So that's unfortunately I don't get to jet set over to fancy places like some of my colleagues do, but there's some pretty neat places in Arkansas to visit for sure. And but as far as like the fresh fruit and vegetable program, some of the more long-term studies are, I don't know, it's been a few years since I've been looking at that. I don't know if it's Finland that has done quite a bit, the Netherlands has done quite a bit. And so as we kind of look at, longer term effects of these, like in the modeling, example I presented, a lot of the evidence we have is from, in the literature is from other countries. Yeah, the fresh fruit and vegetable program is, I think technically you could be up to 8th grade and participate, but I mean, there's a K to 8 school, for example, I think the 8th graders would get the fresh fruit or vegetable snack in that situation, but most of the Arkansas children that are getting it are going to be in K to 6. Okay. Yeah, and actually I don't, so the way the fresh fruit and vegetable program is allocated is there's not enough fun. The school is able to participate if 50% of their children qualify for free school meals or free or reduced price school meals, I believe. I could be wrong on that, but it's 50% of one or the other. Now, but the way the funding doesn't cover all the eligible schools. So if I'm a principal and my school has 80% of the children who qualify for free or reduced price meals, and you're a principal of another school that has 79% that qualify, I might get the FFVP grant funding and you might not, right? So it really kind of goes down, that's how it's allocated. And so that's why I think some of the, if we can explore these kind of programs, maybe, if we could validate what the model is suggesting, maybe we really should be, thinking not just about income, but also about complementary programs. If there's free meals through the CEP, and would the fresh fruit and vegetable program reinforce that, coupling the fresh fruit and vegetable program with the school garden program. And so I think there's a lot of kind of ways we could maybe amplify school meal programs for preference learning.
Uh, Great presentation. Thank you very much. In the literature review that you are more familiar with it is, does the children that they are eating healthy fruit, fresh fruit and vegetable, do they have any impact on their parents or caregivers' health? Because when the kids, they are eating the fruit and vegetable, at least in some knowledge, is just they would demand to go to grocery store with their parents, and they wanted to have more fruit and vegetable. Any comment on that?
Yeah, well, I don't have the literature at my fingertips on that, but I think that makes a lot of sense. You know, I mean, do you think I gave my daughter more tomatoes after after that experience? I mean, she wanted pineapple one day too.
Mhm.
And I cut it up and I took the rind off, and we even had Hello Kitty toothpicks, and I did it wrong because at school they left the rind on.
Mhm.
And so I said, you learned that at school, right?
Mhm.
And so, you know, a lot of times we're just not giving our children credit. Now, this is not in the literature, but it makes a lot of sense that, you know, if by all means, I think most parents are going to be wanting to provide their children with the best nutrition they can. And, you know, some of these healthier foods cost a lot, right? So if I invest in that pineapple and my child doesn't want it, okay, that's an expense that maybe I should have done something else. And so there's some cost, especially if I'm on a restricted budget, to kind of experimenting with some of these healthier foods, right? And if I know the child wants it, then it's not an experiment anymore, and it's a, you know, it's an investment I know is going to pay off. So I don't have a real good answer from the literature, but you know, you can kind of think of the behavioral and economic thought processes that would be going on, and I think what you're saying makes a lot of sense.
The other question is regarding of the Arkansas. More than 40% of the population, they are living in the middle of nowhere in rural area. Do you see any impact differently on the children health versus the, you know, the other county that they are in suburb area?
Yeah, I think, and I think there's evidence in the literature on that. So like, you know, some other economists are looking at NHANES, and you know, NHANES has two different dietary recalls, right? And so you can see the dietary recalls on a school day and a non-school day. And, you know, those that really have poor food environments on the non-school day, you just see such a big improvement in the healthy eating index, you know, as a result of school meals. And and that's really, you know, one of the things that that I want to try to focus on with our outreach through schools is schools are kind of these oases in, you know, food deserts, or I think lila tracks, as USDA likes to call them these days, right? But they're really these oases where children do have a chance to learn healthy preferences, and you know, the work that our community schools in our city is the work that they are doing is just really amazing, you know, to try to make sure that some of these nutritional needs are met in a way that promotes health.
Thank you. Any question on the online? Okay. Any other questions? We really appreciate your, it was a great presentation, and I can reserve your time for next year. Anytime you have a date, you are welcome. Thank you very
Yeah,
much.
you've been a great audience. Thank you.